My great pleasure to introduce our panel. For those who haven't been introduced or haven't spoken yet, I'll quickly try and do justice to that. Professor Clay Gabler is Professor of Biomedical Engineering at Virginia Polytechnic. And Clay, I wonder if you could give us some initial thoughts, as in the last panel, about something you'd suggest we should look at introducing, something innovative that would make a difference.
Yeah, thank you. I think, some of the talks that we've seen, you've seen that there have really been fantastic investments in technology on the vehicle side. I think there's also been fantastic investments trying to change driver behavior. And looking at these things and looking at the residual safety issue, I think the opportunity here really is to begin to apply some of those techniques and ideas to improvements that we can possibly make on the infrastructure side. So if I had to pick one thing, that would be where I would sort of focus on, I think.
Thanks, Clay. Associate Professor Diana Bowman. And Diana is Associate Professor in the College of Law and School for Future Innovation at Arizona State Uni, and formerly of Monash in Melbourne. And a specialisation in, I should have mentioned Clay's specialisation, of course, at Virginia Tech, is in automotive vehicle safety and other matters. But Diana, it's very much around health policy and legislation as it assists policy development. What would you suggest is one option we have to do better?
Well, firstly, I would like to thank the TAC and Monash for having me here in the first place. It's a real honour to be here. In regards to that question, we've talked a lot about autonomous vehicles and technologies this afternoon, and one of the big issues and questions that is being faced is the question around liability and the need for legislation to allow, should we wish autonomous vehicles to come onto the road. What I haven't heard or seen today, and I think is missing from the debate, is a question around data and privacy and what are the potential roadblocks in terms of the social and ethical challenges around autonomous vehicles, again, if we wish to bring those onto the road. And I think we need to start thinking about policy and legislation that will address maybe concerns around privacy and data and potential liability that is generated from this personal information.
Thanks, Diana. Dr. Bruce Corbin. Bruce was, of course, for many years at Monash University Accident Research Centre, has done more than anyone, I'd suggest, in Australia on promoting safe system, particularly infrastructure and safety of vulnerable road users. Bruce, what would you suggest as something that we should be doing?
Thanks, Eric. Look, I'm very attracted, I guess, to the message that Klaus Tingvall delivered about the sort of the bigger agenda about sustainability, about livability, and how we can incorporate safety, an ambitious level of safety into that kind of agenda. And I think the idea of looking at demonstration projects particularly within urban areas, because I think they're better suited to that kind of agenda, but looking at areas of Melbourne or of rural cities and towns where we can actually start to see what that might look like in an urban setting, how the streets would look, how it might interface with sort of commercial activity, just the way in which and how that would, I guess, influence the walkability and the active travel, those sorts of things. So for me, demonstrations is one of the most powerful ways of exploring those sorts of benefits.
Thanks, Bruce. And of course, Professor Mark Fitzgerald, Director of Trauma Services at the Alfred Hospital, and much more as well. But Mark, your thoughts perhaps on the trauma management issue? What opportunities there are there?
Well, thanks, Eric, and thanks for the invitation. I think the thing that's been most interesting in the last few years is integrating pre-crash care and safety considerations with post-crash care and protocolising things and reducing errors, and I'll expand on it a little bit later.
Okay, thank you.
Hi, Sally Rogers from North East Victoria and a community volunteer. Is there anyone else in the room that's here on a volunteer unpaid basis? A community representative. So my big question, well done to everyone that's here, is perhaps a little bit unrepresentative of a few of these conferences I've been to. There's some fantastic knowledge, technologies, infrastructure, but a lot of us are working in the direct coalface with the community, trying to translate from conferences like this to the community. luckily I work in a field of social media and digital marketing, so I'm using that tool. But I'd love to hear other innovative ideas of how we translate all of this wealth of knowledge to our local communities that really want to know about their street, their town, and also being in a rural community, there's been some terrific city examples, but quite often brochures, ads and things are quite quickly dismissed in regional areas because they see traffic lights, they see things that just don't apply to them. We're dealing with snow conditions, we're dealing with deers running across the roads, things that just aren't in the mainstream safety media. So any ideas on that would be great.
That's a good question, but it's quite a comprehensive one. I'm just trying to sort out who among the panel. Anders, I wonder would you have some ideas on that in terms of how Sweden tackled different issues in rural areas as compared to urban areas and so on?
No, it's a really good question and indicating an extremely important area, and that is how do we get people involved in the area of road traffic safety. And our experience is, just as you are representing, if it's starting with the people, if it's starting with families, if it's starting with the ones close to the problem, it will become extremely powerful. And we saw that one of the first decisions made in Sweden was that it was actually the local communities that would set the speed limits. And the next day, our administration had piles of letters from families, from schools, demanding. And I must say that was a very, very good process. I know the people in my administration was extremely frustrated because of the amount of work and because of how many times they had to say no because of lack of money and possibilities. But I really must congratulate what you pick up on the scene here, which is traffic safety comes from the people out in the communities. And don't let grumpy old men like myself stop you. Because you are the power, you are the future. I once initiated a gender analysis on our road safety investigations, the polls we have to the population. And it is extremely important to see how the young people and how the women are a lot more dynamic when it comes to positive change. So keep up your hard work.
Here, and I'm just going to ask, I've pleaded with Sam Cofield to just come and perhaps say a few words about that issue, because I think Sam is closer to that issue than most of our panellists.
I don't know how much closer, but first of all, can I acknowledge the people that are here on a voluntary basis? I know, being a volunteer in another field, how much work people do put in, so thank you very much. I don't think I've actually got an answer for you, but what I would say is that there's sort of two issues in terms of the regional rural areas. One is we know that nearly anything we implement in those areas gets taken up with gusto, and in fact we get much better buy-in and much better uptake than nearly anything we do in a rural regional area. But the tyranny of distance is always a problem when you're trying to disseminate information, and totally agree with you that social media has just opened that world up. But what we do need to do is provide information for you that actually makes it easier. So one of the things that we'll be working on, and probably not the too distant future, is providing a lot more information about the system. So a lot of the types of initiatives that you've seen come up here today around things like barrier systems, vehicle technologies, etc., possibly are using scenarios that are in city areas and more built-up areas, etc. What we're going to be doing is providing a lot more material that can easily be shared online and in those sorts of environments. The other thing is actually localizing. So another thing that I think, well, particularly the TAC, but probably all road safety agencies have been doing, is assuming that one message can reach right across Victoria. So again, trying to talk with local communities about local issues. So in fact, for the volunteers and those who are working in regional rural areas, you'll probably be seeing and hearing a lot more from us in the not too distant future. So, thanks.
Thanks, Sam. Thanks very much. Great. Behind there on table 23. Yes? Thank you. Coming up. Just behind you. There it is. Oh, the one on the left first, yes.
Hi, Howell Rowlands from the city of Burundara. This is going back to a question that Anders was asked a bit earlier, or a statement in terms of a similar reduction in crash rates between kind of Australia and Sweden. And it occurred to me that it was almost trying to compare them as similar countries, which really isn't quite right, because it's an apple and an orange in a way. Because especially when we break down the mode share in those countries, and the amount of physical activity that occurs in other countries in comparison to Australia. Is it time we started to look at that physical activity, that health, almost in the same charts as we look at sort of road traffic crashes?
Well, that's a good question. I think it's very clearly what Stingvale was telling us, but who would like to answer that? Bruce, I mean, that's a space you've worked in.
Yeah, look, I agree with you certainly, and I think it's in line with Klaus's message about it's not just enough to talk about traffic safety now, but there's a whole lot of other issues that are really important to society. Active travel, population health, those sorts of issues really can be supported much more if we get the traffic environment right, get the speeds right, and sort of build, I guess, support social connection, all of those sorts of things I guess the population health people talk about. And I think we in our field can play a really important part. I think local government, which you're representing, is excellently placed to do that kind of thing. And sorry, just to add one more thing, Sam talked about the material, I guess, and the help, the support that TAC can provide in that kind of area, and I know they're certainly happy to provide that, so that can become part of the discourse that you have with your communities.
Yeah, we need local government to drive this, because they are local issues. It's local amenity, local people, local health, local connectivity, the older people trying to cross the roads in high pedestrian use areas, the kids trying to get across the road, sitting there having a cup of coffee with a car whizzing past at 60k. We didn't do it. At 40, there's many more doing it, and at 30, there'll be a lot more doing it. So they're all the issues to look at. There was someone else on that table, I think, too. Thank you.
Ken Diggs, and I'm here on holiday from Charlottesville, Virginia, and I thank the sponsors for allowing me to come. I have a question for Dr. Gabler, and I wondered if he would give us some comments on what he thinks might be the next best thing that can be done for NCAP to improve cars in the United States and in Australia. There's going to be a change in NCAP coming up in the U.S., and I was just wondering if you'd given some thought to that and had some recommendations and some suggestions.
Hi, Ken. Thanks for that question. That very difficult question. So, yeah, I think that there are several things. There's that have been proposed for U.S. NCAP, and some are being done worldwide. We're one of the last countries that has not adopted some form of NCAP testing to ensure that pedestrians are protected. So that's one of the things that's been that's in the U.S. NCAP proposal. But I think that's sort of a catch-up sort of a proposal, and to make it broader. We always focus on, in terms of vehicle safety, we always focus to what happens to people in the front seat of cars. We've seen many charts here about drivers, about right front passengers, but they're not the only people in the car. There are people, of course, that sit in the rear seat, not as many. And I think the thing that a lot of people don't realize is that those, that those belt systems that are in the rear seat of the car just don't work as well. In fact, they don't work very well at all. And we frequently put people who we would consider the most vulnerable in those rear seats. So one of the proposals that's in the U.S. NCAP, and I think it will probably be kind of which will help that problem, is to not only analyze injury risk for the front seat occupants, but also for the people that are in the rear seat. So I think that's the biggest thing that I look forward to seeing.
Cecily Schwab from the National Trauma Research Institute. I wanted to just reflect on Professor Morris's talk. It was particularly resonating because I'm actually a cyclist and I do go down Beach Road, and so immediately I related to the sorts of dangers that cyclists face, but also find themselves in the middle of as well. And I dearly hope that the sort of work that you're doing on the technology side is something that Australia and Australian government will embrace. And one of the things I wanted to ask, and of yourself as well as Anders, is that with all of the investment being made in technology and infrastructure, is there any pressure from your experience? Have you seen any pressure for investment to be made in the emergency medicine systems that support the work you're doing in the technology side? So that when I do go down, and I have been hurt, that I know that I'm in the best possible place I can be because the system's going to support me with the type of major trauma I may have actually experienced.
I agree with you that technology is going to play a big role here in prevention of, hopefully, of pedestrian, cyclist and motorcyclist accidents. But we do need to be a bit cautious about running headlong into technology and becoming over-reliant on it, saying it's going to solve all our problems in one foul swoop. I think what technology is out there is good. We need to do more in terms of perfecting it so that it is more reliable and is more effective. But I think if you look ahead to, say, 10, 15 years, then the technology will be there that will do the job. But I don't think you can just look at technology in isolation and say, well, that's going to be the universal panacea for prevention of vulnerable road user accidents. I think there are other things you need to look at as well, including the way that you design the road infrastructure, so you can find a way of separating cyclists from the passenger cars as much as you can. I know that's difficult and costly, but those are strategic things you can do if you really wanted to be sure to make sure that accidents don't occur. I think there's things you can do about human behaviour as well that need to be considered. I think there are lots of developing theories about behaviour change that we've not really begun to exploit within road traffic safety, and we might need to sort of apply some of those different concepts and see how those can sort of evolve to change in the way that people behave on the roads, not only the vulnerable road users, but also the drivers as well, so that we avoid accidents in that way. And then things through vehicle design. We mentioned a possible part of American NCAP program. There are things you can do to the vehicle which do reduce the risk of injury in the event of an accident. And I don't think we've gone as far with those as yet as we can. And if we can force manufacturers to be more embracing of the technology on vehicles that can reduce injury in the event of an accident, I think we should try those strategies as well. So there's a number of strategies I think you need to implement, and no one in isolation will work effectively.
Thanks, Andrew. Mark, any thoughts on the post-accident phase for cyclists?
Oh, yeah, look, I can stretch an analogy, but it's similar to drivers and the technologies supporting their decisions or error reduction that's automated or semi-automated. And we want the same thing in the post-crash care for the people who are actually driving the resuscitation. So if you look at the military data out of Afghanistan, which is probably the best we've got, about a third of the deaths are preventable from injury. A lot of it's blunt injury, and nearly all of it occurs before people get to hospital. And you've got a very small number of people, often one or two at scene, and they've got, a Dr. Google full of injuries there, and an environment they have to deal with, and a fluctuating patient with undiagnosed injuries, and they've got to have some computerised decision support in real time, remote, perhaps broadband-linked expert decision support, so that all of this information can be delivered for the critical decision they have to make every 76 seconds to save the person's life for the first 30 minutes. And we haven't amalgamated all of that information. So we're not looking for new technologies. We're just trying to make sure that everything that is available is immediately available when the decision has to be made. And that's the hardest step.
Thanks, Mark. I just think on the bicycle issue, I think as a community we've got to get a lot more sophisticated in our discussion about basic safety. If you think of basic safe system, how can it be safe that a person, basically a pedestrian on a piece of metal, is sharing the road pavement, even with a bit of white paint separating them, with a vehicle with a heavy mass travelling at 40, 50, 60, 70, 85 kilometres an hour in urban areas in this city? That is madness. And physical separation is going to be essential, obviously, but where that's not possible, where you've just got a painted white line at best, we have to lower the speeds of the travelling vehicles. And that's a big call. But that's, if you want to keep it within a safe system context, that's the sort of thinking you've got to go through. I don't know what the answer is, but we're not coming up with the right answers at the moment, in my view. There was another lady here.
Excuse me, can I just add one?
Yes, Bruce. Yeah.
One of the very promising things lying ahead, I guess, is that the Victorian or the TAC funded Safe System Road Infrastructure Program, $100 million a year for a decade, I think is a substantial part of that funding, a focus on what does safe system walking and safe system cycling look like in our cities, I guess mainly, but where the main issue is. So you'll start to see, I believe, some new ideas and some new ways of doing things that'll really reduce the risk levels for cycling and walking.
Relevant to country towns too, of course. Dinah?
Sorry, I have to jump in on this one because I'm currently nursing a hairline fracture in my collarbone and 2 pulled ligaments as a consequence of a cyclist hitting me on a campus in the United States. And the cyclist, who I believe was between about 19 and 22, ran a blank corner while they had their iPhone earbuds in and hit me, bounced off, said sorry, and got off on their way. So I think it's not just a matter of the road, and I think that's obviously, you know, where a lot of this happens, but we have to think about things like campuses where we have 70,000 people rushing among different classrooms and those type of environments where we have young adults who are using technology for entertainment and other activities, and the education that needs to go on in that. So that's my very personal story for this afternoon.
Good luck with the recovery. But it's a timely story. Yes, the lady here.
Good afternoon, everyone. My name's Margaret Markovic, and I'm the mother of Daniel, who was killed by a drunk driver after 3 previous magistrate visits. This is Lynette, whose husband was killed by someone with a medical condition. We're here today because of our interest, and we thank you very, very much for everything that you've put forward, the professional dialogue, the academic dialogue, all the work that's going on that's going to benefit people down the track is just amazing. But I'd like to use Luke's opening this morning and bring it back to a humanitarian, personalise the issues related to road trauma as well. I think the challenge is for the community, which has been discussed and mentioned a few times, and the dialogue that's used. What we've enjoyed today is certainly not transferable to community. So a challenge is there, and I would like to think, and I know that TAC and Vic Roads are working very hard on community focus points, meetings and so on, but I think dialogue like mistake, accident, what does that mean? If someone ran a red light, is that a mistake? Or are they going to say, oh, it was an accident? We are good people. We don't get out of bed thinking that we're going to kill someone or seriously injure someone. And it's great to have that representation clinically today to identify. But there's also words like sustainability and livability, which are not really something that victims of death from the road could possibly take on board. So looking at communities, working with communities, we're a volunteer group, Road Trauma Families Victoria, who support families who have lost mainly children, sadly, on our roads. So we are very interested and would love any support or advice, and we would like to do the same to anyone who would like to hear from us in relation to improvements for those who lose their family members and so on the road. But community dialogue, I think, is a key.
Thank you very much. You remind us very forcefully the real reason why we're here, and thank you for that. David, you had a question?
Thanks, Jane. It relates really, I guess, to regional road safety again, as raised by that young woman. In this case, about technology and also hospitals. And I'm thinking of the e-call system, which I think has been made mandatory or will be made mandatory across the EU. Essentially a system whereby if there's a serious crash, there's an automatic dial-up to emergency services. And I'm just wondering, particularly from your viewpoint, Mark, whether, if indeed such a system was introduced in Victoria, from what you know about waiting times, particularly for crash victims in regional areas, whether such a system would confer considerable advantage for their health outcomes back at your hospital.
Well, without having the data to support it, you just got an opinion, but the opinion is it'll make a big difference. I mean, we know that most of our preventable death rates are on country roads. There's disproportionate number of people killed there relative to the population. There's higher speeds. There's difficulty localising the accident site. There's fewer paramedic services, longer response times. And the average time pre-hospitally for a seriously injured person to get into one of the trauma centres now is 87 minutes in Victoria. So we bought new helicopters, just come out this year, 5 new helicopters. We've put blood on the helicopters, we've put ultrasound on helicopters this year so that paramedics can diagnose internal bleeding. We're increasing the staffing. There's a whole lot of technologies, but if there's a delay in response, you get this significant increase in mortality up to about 20 minutes post-response, because we know the easy wins are people just with simple things that be corrected early on. And just to give you an example to finalise it, if you look at survival rates from serious injury reaching hospital, in Australia, the best are in West Australia. So if you're seriously injured and you get to hospital, your best chance of survival in Western Australia, it's because all the pre-hospital times are so long that you've already decided your survivability before you get a pre-hospital response. And we do know that the longer the response, the less reducible the mortality rate is. So we're a very big supporter of this.
In conclusion, there's just one point. I want to come back to the discussion or the subtext to your comment about letting people know what's going on out there, about what they can take to the community. One of the things we do very well in Victoria, certainly, is our behavioural programs and our medical expertise. It's first class. The quality of our roads for the speed limits we put on them is totally out of line with other OECD countries. United States, Canada, New Zealand is the same as us in the rural areas, and they've got worse roads, really. But it is something that we need to talk about. There is a tool being developed called ANRAM, which is an IRAP tool. Don't worry about that name. But is there anyone in this room who knows anything about ANRAM and where it's gone? It doesn't seem to be coming out into public discussion. It's a desperately needed tool that will help us understand risk on our rural road network. And it's long overdue that we have a conversation as a community about that, in my view. Here endeth the lesson. Anyway, thank you. Could you join me in thanking the panel for their contribution and their presentations? Thank you. And if I could just jump in before I leave, I'd like to thank the TAC, congratulate them on this event today. It's a great thing. Thanks, David.
Before winding up, I'd like to introduce Samantha Cofield, who I think is known to many. She's the Senior Manager, Road Safety and Marketing at the TAC, to do a bit of a summing up of the day. Thanks, Sam.
First of all, anyway, can I just answer your question? AMRAM is going places, and I'd suggest you talk to John Matter, who I thought was here. But anyway, it's going places, lots of work's going on. You can talk to ARB as well. Which actually brings me to... I'm supposed to be here to wrap up and give you some key messages. I think that you probably all got the key messages out of today, but I feel that today is actually a day where we can actually feel that it's an exciting time to be in road safety, an exciting time because we've had so much given to us today in terms of the future and where we can go. So many things and so many initiatives that if we embrace them today, if we get on with them today, we can save numerous lives and serious injury, but also a path forward. And I just feel that between the sort of the infrastructure solutions, the technology, including vehicle technology solutions, as well as some of the more behavioural and human solutions that we heard today, that really it's the most exciting time to be involved in road safety. And many of us here who have got around 35 years left in us are probably going to see a day where we get down to close to zero in terms of the number of people being killed and seriously injured. I think the other reason it's an exciting time to be here is because we are here. And as I hear the questions today, I just think how wonderful it is that so many different disciplines, so many different areas are coming together to address one problem. And I know it's often said of Victoria particularly, but Australia, the way we do road safety is quite different in that we coordinate and collaborate very well. But today, I think that collaboration has been taken to another stage, and I particularly think of our trauma colleagues here who have been really supportive but are continuing to get more and more involved in the combined effort, particularly in the volunteers who are here. And we've heard the message that being able to actually translate some of the more technical information that we've been hearing about into messages that the community can understand and take away and do something with are really important. Could I thank you all for coming and for supporting our efforts, but I'd particularly like to thank a few people, and I'm sorry, but I have to do this. Mike Fitzharris, whom you've seen up here on stage, but has been the absolute backbone of the ECIS study and is the main reason we're here today. And another Michael, there's lots and lots of Michaels in road safety. Michael Newstead, can you stand up? Because unfortunately Michael hasn't starred up here on stage today, but he is the Manager of Research, Road Safety Research at the TAC, and drives this from our perspective, and drive it he does. He's incredibly passionate, and it's one of the reasons we've got so far with the study. Can I thank all our international experts? All of you have actually come halfway around the world to be with us here this week to discuss the findings of the study. Hopefully next year we'll be able to share a lot more of those with you next year. Can I give a particular thanks to Anders, but also Klaus, if you don't mind passing it on, who really have given Victoria and Australia a different way of thinking about road safety and a much more systematic way of actually thinking about what we're doing in the future. So particular thanks to Sweden and to yourselves. To all the people who've remained in road safety despite sort of retiring. So Eric, Ian, I know Peter Volken was there a moment ago. Not sure where he's gone. Where's David Healy? David Healy. I think it's you can't retire from road safety, obviously. So I'm really pleased to hear that. I've got a long career ahead of me, obviously, whether it's a volunteer or paid. Again, thank you all for coming, and I would like to just let you know one thing. Today has been recorded, and Monash University is going to edit what's been recorded down to something that's a bit digestible. So in about 4 weeks, we should be able to share with you what happened today, and hopefully in terms of getting messaging out to the community, there'll be something to talk about. So thank you very much.
And thanks very much to you, Sam, and the whole team at the Transport Accident Commission, and Jude and Mike, obviously, and the team out at the EKIS project at Monash. We're very grateful for your support in this seminar happening. I think Sam said all the thank yous. I won't repeat them, but certainly they're heartfelt on my part, and I'm sure on your behalf too. I'd like to thank you all for taking the time to attend. My view as a seminar is if indeed you come away with 3 or 4 things which are new and for you which are actionable, which can make a difference in terms of road safety, then it's been a very successful seminar. I hope that's the case for you. It certainly is for me. It leaves us now really to thank first of all our panellists and our presenters and our facilitators. Could you please join me in thanking them all for all the work they've done? It's left for me now just to wish you a very safe trip home, and thank you.